Okay, so good evening, and thank you everyone for joining. Ofer Jacobowitz, I wanted to welcome you to Advancement in the Treatment of Obstructive Sleep Apnea, Inspire Therapy. So I'm the co-director of sleep at ENT and Allergy Associates. I'm also an associate professor at Hofstra University at the Zucker School of Medicine, and I'm also the chair-elect of the Sleep Disorders Committee of the American Academy of Otolaryngology. Just to get started, I'll have Megan familiarize you with the platform we're using here.
Hi there, my name is Megan Koschel. I'm the territory manager for Inspire Therapy here in Manhattan. Please note that this meeting is being recorded. You can go ahead and go on to the next slide, Dr. Jacobowitz. So this is in regards to the Q&A. If you have any questions, please just hover your mouse over the lower half of the screen. A bar should appear with the Q&A button. Click on that Q&A button, type in your question, and then we will have your question answered at the end of the presentation. Thank you.
Great. Just remember the question should not be a personal question about yourself, but rather more in a general style, as we don't want to divulge any personal information on this webinar. Here we are. So I want to tell you a little bit about my personal journey because it is relevant to what we're doing tonight. So to give you a little background about myself, I've always been very inquisitive, science-oriented. So I started my journey at MIT, where I loved and enjoyed studying biological sciences, but I also worked in computers and even studied French literature. But quickly, with all the science and technology, I realized that I wanted to be in medicine where I could hopefully help people. So I combined my interest in science and medicine by going to Mount Sinai and entering the medical scientist training program, where I obtained an MD PhD. And then I selected otolaryngology head and neck surgery because I found it both challenging as well as really an open territory where I felt that the medicine and the science is really going to take off in the future, but there's a lot of room for improvement. So then you finish the residency, you go into practice. And from the very first, literally the very first, couple of months, it was obvious to me how many people are walking through the door that have sleep apnea and don't know it or are seeking treatment. It was very obvious to a head and neck specialist as to how common sleep apnea is and upper airway narrowing is, which is a risk factor for sleep apnea. So I started practicing, and as an ENT surgeon, of course, I began treating people surgically. But the more I read and the more I tried to explore the condition, the more I realized that it's quite complicated, not easy to treat, and I really wanted to treat the condition comprehensively. And so I went to the next step and became board certified in sleep. And that allowed me to better treat my patients with CPAP, with oral appliances, and of course, nowadays with hypoglossal neurostimulation, such as the Inspire therapy. And so to, again, take myself to the next step, I also had a variety of academic positions from Columbia to Mount Sinai and Northwell. And then I took my interest to a national level where I can collaborate with experts around the country and around the world. I was the past chair of the sleep-related breathing section of the American Academy of Sleep Medicine, and currently of the Sleep Disorders Committee of the American Academy of Otolaryngology. And then we had, I was the meeting chair in 2019 of the International Surgical Sleep Society in New York. That was the last great meeting pre-pandemic. And of course, the highlight of that meeting nowadays was hypoglossal implantable neurostimulation. And also, I've also been the associate editor of the textbook, seminal textbook, Sleep Apnea and Snoring. And I'm currently the co-director of sleep at ENT and Allergy Associates. So the journey has been a long journey, but at every step along the way, it's been a quest for improvement and trying to improve the treatment, which is not simple for sleep apnea. So what is sleep apnea? Think of it very simply as in the following fashion. So, you know, the throat is quite stable and firm when we're awake. Think of it like a pipe, and it's solid. But during sleep, your muscles relax. The tongue relaxes, the throat muscles relax. And so the throat becomes collapsible as well as somewhat narrow than during wakefulness. Think of it almost like a straw or a bag that can collapse on itself, especially as air flows through it. Also, when the air flows through a throat that's floppy, there is snoring because the bag or the straw can vibrate. And certainly when that happens, and the throat becomes narrow enough, obstructions can occur, and they could last quite a while. This is, for example, an obstruction of 47 seconds, and you can see oxygen dropping to 84%. And here is an obstruction that can last a minute and a half. And you can imagine how frightening this may be to whoever is sharing the bed and observing the obstruction. It's quite prevalent. Over 20 million Americans are estimated to have moderate to severe obstructive sleep apnea. And so as a consequence of these obstructions that happen over and over during the night, and just to give you an example, moderate sleep apnea may mean anywhere from 15 to 29 obstructions per hour. You can imagine that this fragments your sleep, and so it leads to fatigue and diminished productivity and difficulty concentrating. And of course, the noise of snoring and the quiet periods in between snoring actually altogether fragment the sleep of the bed partner, of course. As a result of interrupted sleep, there's a risk of accidents, both of your own vehicle as well as of public transportation. And there were multiple, public transportation accidents. This one in the photo on the bottom is from Metro North. As you recall, the accidents from years ago, but there were numerous accidents of the sort. And if you take the combination of interrupted sleep plus drops in the oxygen, that is a very unhealthy setup for a variety of organs, especially the heart and the brain. And so there's a greater risk of heart attacks, strokes, and dementia when it comes to moderate and severe obstructive sleep apnea. So having said that, obviously we're looking for treatment, and we're going to go to CPAP first. So we have CPAP, and this is some people's view of CPAP. It's a Darth Vader mask that is huge and very uncomfortable. But CPAP can have another look, which is a minimal interface that's pretty comfortable and a pretty elegant machine. So CPAP is a treatment that the majority of people can get used to. But again, there's a large group of people that are unable to get used to CPAP, and they need an alternative. By the way, a common reason for CPAP intolerance is the nose, nasal obstruction. The nose has to be open for all good treatments of sleep apnea to be effective. So this is something you can see myself or another ENT for assistance if you have nasal obstruction. Oral appliances also can be comically looked, again, perspective, as this, and this is Jaws from James Bond movies, of course, and that looks quite hideous. On the other hand, oral appliances can be actually comfortable, well-fitting, and effective. No treatment, of course, is perfect. So with oral appliances, effectiveness is not the case for all people. For some people, they're uncomfortable, and they do have a risk of changing your bite, your occlusion. And so the way they work essentially is by pulling the jaw forward and stabilizing the muscles of the throat by pulling on them. So that's the mechanism. That's also why it's somewhat limited in effectiveness in a variety of people. Sleep surgery is also on the menu, and sleep surgery may be thought of as this, the big knife, the really big knife. And you can watch the patient's face in horror. And that's how some people view any surgery. And some doctors may also say, don't have surgery, it's only 50% effective. But that is grossly incorrect. It really reflects a lack of understanding of current techniques. So I love the 80s, but current surgery is not the surgery of the 80s. And in fact, this is the face of surgery in 2021. And this is a picture of a throat after surgery. And I can tell you as an ENT, this looks completely natural in terms of the contours of the throat. And so modern surgery is also an option. It has about a 75% effectiveness rate in expert hands. So we do have options, but again, we need more and more options. This is a complicated problem, and we need to offer a variety of treatments to help people. So I started with surgery, then CPAP, then oral appliances, then additional options. And finally, we arrived at hypoglossal neurostimulation, that is stimulating the upper airway by activating the nerve to the tongue. This is a small article that was written in the Sleep Journal about this journey. So now we arrive at hypoglossal neurostimulation. So it is the new frontier, just like you see the Star Trek Enterprise, embarking on the final frontier. It is the new frontier, but guess what? It's not that new. This is 2012, where I made my first presentation on this topic at the International Sleep Surgery Conference in Venice. And this was the beginning, but this all happened, of course, as our technology has improved continually over time. If you think about Star Trek, we have our dashing Captain Kirk, that, as you may or may not know, Bill Shatner actually developed sleep apnea. But if you reflect upon Star Trek and you look at the various technologies they were using, they had communicators, which, our cell phones are much more sophisticated and have amazing video and communication technology now. And if you look at all their medical tools that were science fiction then, they're not science fiction now. They're actually science. And we have handheld tools that do a lot more than the tools on the show used to do. So technology actually brought us to today. And now we have the Inspire system, which is powered by this device that's implanted in the chest on the left-hand side. It's called a pulse generator, and it does deliver pulses to the tongue in order to activate the tongue during sleep. And you activate it simply with a remote control. You press the green button and the therapy activates, and when you wake up in the morning, you turn it off. So this is a little quick video to show how it works. Essentially, you connect you activate the device by pressing the remote, and then the therapy works by sensing breathing and then trying to time the breathing to the pulses that are sent to the tongue. And as the tongue activates, it actually moves forward, but the throat probably enlarges and stabilizes more by the action of the tongue being connected to the walls of the throat. So as the tongue is connected to the walls of the throat and the tongue moves forward, it actually stabilizes the walls of the throat at the same time. And that's the same video. So how do we do it? So you need to have a procedure. The procedure involves implanting the components in the body. And it used to be inserted through 3 small incisions. Now it's 2 small incisions. The incisions basically happen, we make them in the upper chest, 1 incision in the upper chest and 1 under the chin. And that allows us to implant the power source, the pulse generator, as well as the sensor through the same spot. And through a small incision, the attachment, the cuff around the nerve is implanted. And the 2 areas are connected by a very skinny wire that's all passed underneath the skin using a cannula, using like a little hollow cannula from point A in the chest to point B in the neck. And all that's done in a procedure, which is ambulatory. So it's performed same day. You will typically go home on the same day. It's not very painful, actually. The pain is typically mild, and I don't prescribe any heavy-duty painkillers. Just take Tylenol after the procedure. And really, you can return to regular activities within a few days, although we don't want you performing a strenuous activity in the short term so that the system gets to heal in position without a problem. All surgeries, of course, have a risk, and the risk of this surgery are pretty uncommon. With all surgeries, there's a small risk of bleeding in the area. There's a small risk of infection. And specifically to this surgery, since we are putting the cuff around the nerve, there's a small risk of weakness of the nerve. And those are essentially the risks, but uncommon, and thank God dangerous or serious complications have not occurred in my hands. Once the system is in, of course, it's implanted in the body. So in the future, it will need to be replaced or updated in some way. And so the battery life, we estimate at about 11 years. But fortunately for the battery replacement, that is not a complex surgery, and that does not even require general anesthesia to perform. It can be done under local anesthesia with sedation. Since it is a metallic electronic system, there is an exclusion when it comes to MRIs in this region of the torso. So that means that you can have an MRI of your head. You can have an MRI basically up to your chin level. You can have an MRI of your arms and legs, but the MRIs of the spine on the body are not approved based on the current design of the Inspire system. So that's an important consideration that you must realize if you have very significant spinal problems and do need MRIs. That would be a problem. You can have CAT scans, but not MRIs. In good hands, we get good results and with good technique. And so just as much as we want to have a good implantation and make sure the surgery goes safely and well internally, obviously cosmetics are also important. So just to show you, these are two of my patients that I've implanted many years ago. And you can see scars camouflage really well. These photos were not Photoshopped. And the arrows are pointing to where the scars are on the left side on the chest and on the right side on the neck. Of course, occasionally you can have scars that are more prominent. And certainly when you have something implanted in the chest pocket, which is the pulse generator, you can feel it, and it may be slightly apparent depending on how thin or how thick your skin is, of course. So you've had the surgery. Surgery went well. We give time. We give healing about a month to let everything settle in and secure in position before activating the therapy. So all goes well. Then a month later, you come for the visit in the office. And this is just a schematic video. So the gentleman is lying down, and we make a connection to the device. We have a nice tablet where we can activate it and make sure that the activation of the tongue is comfortable as well as effective, so we can actually see the tongue moving when we turn it on. And then you will be introduced to the remote control, which is the way you're going to interact with your device. The remote control is very easy to use, very easy to connect, and you will learn how to increase the treatment over time in order to get effective stimulation and good sleep. And likewise, if there's any problems, you can also reduce the stimulation and make sure you're comfortable during the night. So you get the whole kit and the whole information, that visit, and then you're on your way. Just to give you a little interesting vignette here, if you look at the video, the anatomical video here, what you're looking at is the bird's eye view, looking down the throat from the top down. And on the bottom, you see the tongue. And the tongue is being activated now. This patient is actually awake. And what you can see is that when you activate it, the tongue will move to the bottom of the screen, which means that it's moving forward. But look at the side of the throat. Look at the sidewalls of the throat as the tongue is activated. And you can see that it becomes stiff and right. And actually that, I think, is the main mechanism of how things are working. It's the connection of the tongue to the walls of the throat. But the treatment is made so it's comfortable and will not wake you up. If the treatment is waking you up, we have to decrease the stimulation and make sure you're comfortable. And it has to be obviously comfortable and effective for any treatment to be used and to be a good treatment. So this is a clinically proven treatment. There was an excellent clinical trial that was actually published in the New England Journal of Medicine. And what we've shown in the trial is that there was a great reduction in the rate of obstruction per hour. We call it the apnea-hypopnea index. And so the AHI mean was 29 times an hour of obstruction, and the mean went down to 6, which is about an 8% reduction. This was done in a clinical trial with follow-up to 5 years. So this is a durable effect. Now, of course, you might say, if you have any background in clinical trials, you know that the people in clinical trials are highly selected. And so the results from clinical trials don't always apply to the general population. And so what was very good is that the company Inspire then initiated a clinical registry. Basically, after approval of the device in 2014, people were followed and registered in order to look at the success rate. And in terms of this apnea-hypopnea index, there's approximately a 70% success rate in a clinical registry, which is excellent because, again, when we're talking about people who have tried and failed CPAP, so to be able to rescue that group of people is really an excellent result. Likewise, we care very much about snoring. So just as sleep apnea is dangerous, the quality of life is a critical issue. And snoring in a clinical trial, as reported by the bed partner, went from 83% to 10%. And that is a great reduction and a very, very important metric in terms of success. Any treatment, the best treatment that may be the most incredible treatment in the world is useless. It's worthless unless it's being used. And with the Inspire device, you as well as we can actually assess how much you are using it. The device can download information, and we can actually measure the usage. And the usage that was recorded here is about an average of 6 hours a night in the registry. And this is an excellent time of usage if you consider how many hours people sleep, and they do get up, of course, here and there during the night. So this is an excellent result in terms of the ability to use the treatment and the real life usefulness of the therapy. The results, as we said, have been published. There have been numerous publications of the topic. There's long-term follow-up on the therapy, and there's been thousands of people who have enrolled in the registry. And again, the more the better, because this allows us to improve the treatment and to always learn and always enhance the therapy. The other piece of good news is that with thousands of people that have received it and with experience, the insurance companies have been convinced now that this is a valid and valuable treatment. And so most insurances do cover the treatment, which is fantastic. Of course, it does not mean that it's not going to be a fight, and it's not going to require a lot of effort to get the treatment approved sometimes by some insurance companies. And so if this sounds interesting, the next question is, of course, are you a good candidate for this? And so you need to have moderate to severe obstructive sleep apnea. So technically on a sleep study, it means you need to have at least 15 obstructions per hour, 15. And truly, you need to be unable to get consistent benefit from sleep apnea. So either you're unable to use it, you're using it very minimally, a couple of hours, and really the CPAP is just not working for you. This is not a treatment for people who are using sleep apnea, doing well with it, but are looking for an alternative. At this point, this is not an alternative to folks who are using sleep apnea well. In terms of weight is important. So your body mass index should really be less than 32. And really the therapy, in my opinion, seems to work best in people who are overweight or not overweight, but not obese. The reason why, again, if you think about the differences, CPAP works as basically inflating a balloon. If you think of your throat as a balloon, it doesn't make a difference what the balloon looks like. Once you inflate it, it becomes stable and open. With the Inspire therapy, the neurostimulation, as I was explaining, it acts by pushing the tongue forward and the tongue connection to the throat. So if you can imagine, if the walls of the throat are too thick due to the weight, it's going to be hard to overcome their collapse. And so that's a simple way to think about it. So it doesn't mean that it cannot work in in obesity, and some people, of course, may lose weight and they can become candidates, but this is a limitation that's important. Likewise, you should have a good upper airway examination by myself or other people who are performing this implantation, because we may find certain issues that make you a poor candidate or someone who should have another treatment. For example, if you have huge tonsils, you should really not be getting this treatment. You should have a tonsillectomy. It makes more sense. The treatment is only approved, the treatment we're talking about here is approved for adults, although there may be some role in some very specific conditions in pediatrics. And there's another hurdle, which again is important, because we only want to implant this in people who will have a good response. And that is performing and having a sleep endoscopy. It's essentially the same examination that's done in the office where I would look into your nose and throat with a fiber optic telescope gently, but this is done during sleep or sedation, actually, drug-induced sleep. And we're trying to exclude a severe collapsibility of the throat. Again, for the same reason, that severe collapsibility may be difficult to overcome. So there's a certain pattern we look for, and if you pass the sleep endoscopy, then you're good to go. Again, consider that there's an exclusion with MRIs of the spine and body in the future. And then finally, if you haven't had a sleep study in the last 2 years or so, then we should get a new one in order to obtain an accurate reading and assessment of your obstructive sleep apnea. So those are the qualifications. Those are the inclusion, as we say, and exclusion criteria. And so you have options. So you know from this presentation now that sleep apnea is quite important to treat for both your quality of life and health. And hopefully this gave you a little perspective that there are multiple treatment options, but none are perfect. They're all good, none are perfect. And the goal is obviously to find a treatment that will work for you. And certainly if you've not succeeded with CPAP, then Inspire treatment is a good option, perhaps, if you are a good candidate based on all the criteria we mentioned. And as we said, this is a treatment that appears to be both safe and effective in most selected individuals. To find out more and to see if you do meet the selection, of course, and whether this is a good treatment for you, I would recommend you obviously make an appointment with me if you like. Our number is there, 646-868-4300. You could also find me at entanallergy.com/Jacobowitz or at the nysleepsurgeon.com. And these are some telephone numbers for Inspire as well below, where they have lots and lots of information by phone as well as online, of course. So thank you so much for your attention. And I look forward to answering as many questions as I can. And also Megan from Inspire here will also be happy to answer any questions you have that are more related to their side. Thank you again.
Great, thank you, Dr. Jacobowitz. So I will read the first question for you to answer. I travel a lot. Can I go through a metal detector at the airport if I get this procedure?
Sure, of course. This will be critical. So you will have a card and other ways to identify that you have this device. So it is not a problem.
Great. The next question: how long is the latest sleep apnea test good for?
Yeah. So there's no absolute, but I would say probably in the last, if you have a test from the last year or two, that should be fine. Obviously, there's changes that happen, and also there may be some requirements from insurance companies to have a recent test. So if you have a test from 5 years ago, that will not suffice. But if you have one from the last 2 years, it's probably okay.
Okay. What side effects have you seen in patients?
Side effects. So the device is implanted. Once it's implanted, again, it becomes integrated into your body. And so I guess you're asking, the side effects you're asking is a result of therapy. So with all treatment, of course, we have to adjust the stimulation level to make it comfortable and not bothersome. So with this treatment, if the therapy is too strong, you may find uncomfortable discomfort. Initially in the clinical trial, there was some abrasions of the tongue against the teeth, from protruding the tongue strongly. If the device is acting, if the stimulation is too strong, there's a possibility that it may wake you up from sleep. But this is where two things come into play. One is obviously selecting the right person for the therapy. There are some features that we look for to make sure that you're a good candidate. The other is obviously the way that we can modulate or adjust the treatment. And the beautiful thing is that you have control of the treatment with that remote controller to adjust it up or down for your comfort and effectiveness. And if at the beginning, the treatment appears to be too strong and you may feel it that it's too strong, that's okay. We'll keep the therapy at a lower level and then you actually get used to it. And then down the line, we can increase the strength and then it doesn't bother you any longer. So those are the typical, sort of side effects. Again, realize that all electronic, systems can at some point have a problem or fail in the future. And this is why we mentioned about the battery and replacing the pulse generator in the future. And of course, like any accidents can happen. So, people have had, physical accidents where they broke the wire and it needed to be replaced in the future. But those are obvious issues that can occur on any system.
Thank you. The next question is, after the implant, can the person feel the device in the neck and chest?
So in the chest, you can definitely feel it because obviously it's firm and you can definitely feel it. And there may be a small bulge. It depends, like I said, on the thickness of the skin and so on. So absolutely, you can feel it. We do secure it so you can't play with it, but yes, you can feel it. It is there. It's underneath actually it's underneath the tissues, but it is anchored to the muscles of your chest. Yeah, but you can be physically active. I've had people who are ballroom dancers and people who are very sporty, do a lot of physical activities. It's not a problem.
Do you have to be sleeping in a certain position on your back, for instance, for the implant device to work, or can you sleep in various positions and move around during the night?
That is a great question. So the answer is you can sleep in any position, but as you may or may not know about sleep apnea, in a large number of people, sleep apnea is worse actually when you sleep on your back. So in some cases where whether it's this therapy or another therapy, where we use the treatment, but there's still residual sleep apnea, or we want to treat it better, we want to treat it more, very often we combine it with not sleeping on your back. But the answer is yes, you can use it in any position.
How many of these type of surgeries have you performed?
So it's a good question. I haven't counted, but I've been performing them since about 2013. I've implanted mostly implants with a company called Implantable and fewer with the Inspire because of my work as a consultant and researcher in the field. But I've been implanting these, like I said, for the last 8 years or so.
Okay. Next question, does sleep apnea lower your oxygen level? Also, is the procedure covered by medical insurance?
Yeah, so sleep apnea by definition lowers your oxygen levels while you're sleeping during the episodes where you are obstructing. So the oxygen levels will drop by a minimum of 3 or 4% each time. But oxygen levels can drop by 30% during severe obstructions. So absolutely, that's one of the major risks of sleep apnea, that it can damage all these organs in the body that are dependent on oxygen. As I was saying, the procedure is covered by medical insurance, by most insurances. It does take some work getting the procedure and treatment approved, but yes, it's covered by most medical insurances.
Great. Next question from Karen is, can the product be removed completely?
Yes, it can be removed completely because it really has just three components. It has the pulse generator, the power source. That's like a little box, as we say. It has a sensor that's connected to it, and then it has the third part, which is a little wire, a little skinny wire that has the cuff that goes around the nerve at the in the neck. So if somebody needs to have the system removed, then everything is removed typically.
Okay, so the next question is a sleep study required?
Oh yes, a sleep study is required, and also really in addition to the sleep study, a CPAP, air pressure therapy trial is also required, at least a trial. Yeah.
Okay, we have a few more questions. What happens if you need an MRI in an emergency situation? What happens if an MRI is?
Yes, well, I mean, if it's an emergency and it needs to be done, then actually, unfortunately, the system needs to be removed because of it really is, it's an FDA issue. It's the way that the system is approved. It's more of a precaution, but at the same time, it's a requirement. So it would have to be removed surgically.
Just to follow up on the MRI, the device is MRI conditional, so the patient can have an MRI with head, neck, and extremities, just nothing in the middle of the body.
Right. So yes, if you have an MRI, if you need an MRI of your brain, then that could be performed. Next
question. Where can I see you?
Right here. No, just kidding. So I'm located in Midtown Manhattan at 18 East 48th Street. It's right by Rockefeller Center. As I said, if you just look up my name online, or just type in nysleepsurgeon.com or at entanalgiassociates.com, then you can find me right there. We're a couple of minutes walk from Grand Central Station, so it's pretty easily accessible. But thank you for the question.
Great. Next question. As a singer, would this affect my voice in any way?
Very interesting, but the good answer is no. And the reason why it's very interesting to me is that, we think actually that the voice and the acoustics may be a little different in people who have sleep apnea than people who don't. But to answer your question, I'm not aware of any voice changes. The only way that I think in some ways is that, with sleep apnea, if you think about what happens at night in your throat, it's mechanical trauma. It's all this chaos that's happening in the throat, with the palate getting beaten up as it vibrates against the back wall of the throat. So there's swelling that actually occurs in the throat. And those of you that have sleep apnea and have woken up in the morning with a swollen palate and swollen uvula, you know exactly what I'm talking about. So in some ways, treating sleep apnea using this or other therapies is beneficial for voice.
Great, thank you. So the next question is follow up on the oxygen level. Can your oxygen level drop as well when you're awake?
Not from sleep apnea. During wakefulness, again, you have the muscle tone, and so your throat is that stable, solid pipe. It will oxygen can drop for other reasons, but not from sleep apnea when you're awake.
Great. Who would remove this system in an emergency, say in an ED? Also, what information would you need to carry with you so that the emergency department staff is aware of this use?
Great. I mean, I would think, who would remove it? Well, I would think that, the good news is that this is a very familiar and well-known system now across the United States, and there are numerous surgeons who perform the surgery. It doesn't require great skill to remove it, just caution, of course, to do it carefully. So I would think that any, ear, nose, and throat head and neck surgeon should be able to remove it. Doesn't have to be the surgeon that implanted it. And I'm sorry, what was the last part of the question? You said about who can remove it, and if you
so
need
the last
emergency.
part was just what do I need to carry?
Right, so just identification. I mean, as identification card. Anything else, Megan, that
no, that's it. So patients receive an identification card prior to discharge, or if they don't have that, they can always contact the local Inspire rep by contacting your office if they have an implant, of course.
Right. Thank you.
Okay. So the next question, how long should someone try CPAP for before considering this?
Good question. How long? I think the answer is give it a fair trial, So, the insurance companies typically give you a 90-day trial of CPAP. The question is not really the length. The question is like, was it a good trial? And was it really in good hands and someone that helped you through it? Because all new things and all changes in lifestyle are difficult. So you want to make sure, like I said, that you couldn't use it because of nasal obstruction that was untreated. You want to make sure that the doctor fitted you with something really comfortable, like that little mini interface I showed you, and not a giant interface that's so uncomfortable for so many people. A full interface, it's called. So you want to make sure you gave it a fair trial and realize no treatment is perfect. Like I said during the presentation, all treatments have advantages and disadvantages, so you have to weigh them carefully. And sleep apnea is going to change. What we have now is going to change, in the next 5 to 10 years, and there'll be new versions of what you see now, and there'll be other treatments that I didn't even mention yet. So things are moving in a good way. So if you have sleep apnea, it's an exciting time. It'll be a good time, and think positively.
Thank you. So the next question is, can a sleep apnea test be ordered before the office visit if I'm a patient that saw you about 2 years ago?
Yeah, so yes, but for sleep tests to be ordered, you do need a visit in order to order a sleep study. There are certain requirements, regulations for ordering sleep studies. If it works, if it's convenient, obviously you can see me. If it's not, then you can even have another doctor order it for you. But a visit is going to be required to order the test. It's probably better that if you're my patient, it's better that you see me, because then I'll have direct access to the sleep study data, and I can really analyze it most accurately. So sorry for the inconvenience, but it would be needed.
Okay. About 20. Hold on, I'm sorry. There's a lot of questions coming in. Oh, how is this better compared to the traditional sleep surgery?
It's very different. I mean, one of the main differences is that there's much less pain because, and again, I'm going to try to answer what traditional sleep surgery means, but definitely less pain because it's more of a soreness of implanting something in the body. The modern sleep surgery now is not about removing tissue. So the old surgery was about cutting out all this tissue from the throat, which is not what surgery is now. The only tissue that's removed from the throat, typically in my hands, is just tonsils especially if they're significantly large. But certainly there's greater pain, and that's the main difference. So for example, with this type of therapy, the next day you're able to eat and drink normally, whereas with sleep apnea surgery, you'd have quite a sore throat for at least 10 days, and you'll have it for longer, but in the first 10 days, you have quite a moderate to severe sore throat.
Okay, the next question is, if one was on CPAP therapy with another provider before, can we still go straight to Inspire?
Yeah, you can. I mean, like I said, you want to make sure that you've really been, the CPAP pathway or that the CPAP therapy was tried as best as possible, and that the appropriate and so like I said, whether it's nasal obstruction or the comfort or whatever problems were causing you to have difficulties with CPAP, that they were addressed, or at least some attempts were made to address them. But if you feel the doctor really tried hard with you and you did your best, then yes, you can just come in for a consultation at that point. You do want to bring all your records in the sense of like the former sleep studies and any other information that could be relevant with you.
Thank you. So the next question, I think you answered this, but do I have to try CPAP before I think about Inspire?
Yeah, it's required. You will not be able to, even if you're a good candidate, no insurance would agree to this without CPAP trial.
Okay, so the next question here is, if you lose your remote control, can it easily be replaced?
Yes.
Would you like to give the answer? Okay. Yeah. Yes. So the remote is covered by insurance. However, if you want an extra remote, there is an out-of-pocket fee. And if the remote needs to be ordered, you can just go through the medical office and they will place a prescription for the patient.
Yeah. And also don't worry that the therapy is programmed in a certain, just by the way, on a day-to-day use, the therapy is programmed for a therapy window also, and it will stop. So during the day, you will not have the system turning on, your tongue.
Okay. The next question, would this interfere with dental work such as implants and bridges?
No.
Okay. Another question is, does this affect airport screening? We did have a question earlier about going through the metal detectors, so this won't. You can absolutely go through the metal detectors, and you can also let the TSA agent know that you have, we usually just tell the patients that you have a pacemaker, because obviously a lot of TSA agents don't know exactly what an Inspire device is. They can always warn the patient as well. But this does not affect the airport screening. Next question. What's the BMI cutoff?
So typically it's around, I would say around 32. There is some flexibility, but as I was saying, like with a greater BMI, there may be less effectiveness. So embarking on some weight loss is also a good idea. But approximately 32, I would say.
Will it affect the Inspire medical system when having an asthma attack, coughing constantly?
Great question. I mean, I think it could definitely affect the sensing of breathing. But anyway, when you have it, so let me reverse the question. So there is a connection between sleep apnea and asthma, and actually treating sleep apnea probably improves the management of asthma. So that's a big plus. But of course, when you have an asthma attack, it's you guys got to treat the asthma attack. So we'll confuse the sensing in terms of breathing, but like anything, like you got to manage the asthma attack. If you have a severe cold, of course, then again you're going to have more trouble breathing at night, even without asthma, and it may be difficult. You may have a little bit more sleep apnea when you have a bad cold for the same reason.
Okay. If someone has large tonsils, does a tonsillectomy resolve sleep apnea entirely?
So case by case, so if the tonsils are truly large, then tonsillectomy, especially in younger people, can be quite effective. But in many people, the tonsils may appear large, but it could be an optical illusion because the walls of the throat are really thick and they're pushing the tonsils closer together. So it needs to be carefully looked at. And like I said, more commonly tonsillectomy, other than very, very young people, is combined with additional think of it, we call it pharyngoplasty, which means plastic surgery of the throat to reposition the muscles of the throat in order to stabilize them and enlarge the caliber of the throat. But tonsillectomy in some people can be quite effective.
Thank you. The next question is, I have cervical fusion. Can I still use Inspire?
Right. So again, it begs the, in short, yes, but also, you know, with the issue of the MRI, that would be a major concern for me. So if somebody's had surgical fusion, I would be concerned about implanting the system just because of the need of future MRIs and assessing, assessing other spinal issues, not even at the same level, at different levels.
Great. Okay, so if I see you, can I have a new sleep study done at the ENT facility in Middletown, New York, where I live, or must it be done in the city at your office?
Sleep studies, if you see me, there's different ways to do sleep studies, and they don't have to be even at a facility. They can be done as home studies. So the sleep study can be shipped to your home, and we can do a home study, and that can qualify.
Great. I have had incidents of severe uveitis to the point where I couldn't talk. Is that a good reason to have the implant?
So typically, you know, uveitis here, to me, it means that the uvula swells during the night and in the morning, you know, from snoring, from really, it's a punching bag, literally. So if this is occurring due to the sleep apnea, then the answer is you have sleep apnea, you need treatment, and whatever treatment is appropriate should be implemented. And so the answer is yes. If you've tried CPAP and you didn't succeed with it and you still have sleep apnea, then you may be a candidate.
Thank you. Okay, we have a few more questions left. The next one is, would you need to have a recent sleep apnea test before being evaluated by Dr. Jacobowitz?
Yes, as we said, you know, we want a sleep test within the last 2 years, and also provided there's been no, you know, weight changes, you know, either up or down as well. If you had like a major weight, you know, loss or gain in the last year, then we definitely want to repeat the study.
Great, thank you. Wouldn't the body tissue attach to the device?
Great question. So yes, so the body naturally forms a scar around anything that's a foreign body. But the scar actually, in some ways, keeps the device in position. So around the pulse generator, the pacemaker in the chest, you'll actually have a little sac, like a little sleeve, and it walls it off and it keeps it in place. And so the scar actually makes it, secures it into position. So it's natural. Of course, you're going to have a scar around it. For that reason, of course, if the device is ever removed, then one goes carefully through the scar in order to remove it. In terms of the chest area, it's very easy. I mean, you just kind of pop open the sac, and then you can take out the pulse generator very easily. It comes right out.
Okay, great. Next question. Okay, I'm using CPAP about 2 years, but has become bothersome to a point where I have to take over-the-counter sleep medications in order to get through the night using CPAP. Can this given consideration to get approval for Inspire?
Yeah, so it's a great question. You know, I think that that's an excellent question. You know, in my mind, if you really need the sleep medications to use CPAP and not for other reasons, then that tells me that there is a problem with using CPAP and that CPAP disturbs your sleep. So it's a tough question, and the question is also how insurance companies would look at it as well, because they may say you're using CPAP and you're okay. But I understand the risks and benefits of taking sleep medications as well. So, you know, in my mind, if you must take sleep medications only to use CPAP, then it tells me that there's a problem with using CPAP as a clinician.
Thank you. All right, we have 3 more questions left. The next one is, about 25 years ago, I had a CPAP and was very uncomfortable. My ENT removed my uvula, which stopped the snoring and the loud noise. However, I breathe through my mouth, which creates some noise, but not as worse as the sound from my noise. Would I still be a candidate?
Right. So the question is really, what's your status? What's the status today? So a sleep study is needed in order to assess, what's the condition now? Is there sleep apnea or not? Because sometimes not snoring loudly doesn't mean that you still don't have sleep apnea. And having had surgery 25 years ago is okay, actually. That doesn't put one in a worse position. Let me think, what else? Sorry, was there any other part of the question that I didn't answer? You said the procedure was done 25 years ago. There's some abnormal sounds. It just needs to be reassessed. Is there sleep apnea or not? And to what degree? And again, if it was 25 years ago with the CPAP, I would say try it again, see how it goes, because 25 years ago is 25 years ago. It's very different.
Great. And the last 2 questions are actually pretty similar. So it's essentially, I've successfully used CPAP therapy for more than 10 years, but this sounds like something I would like to try. Would insurance consider covering it, even though I'm not struggling with CPAP? And then, basically, what does success or failure mean with CPAP? If I'm getting benefit from the CPAP, where is the line for qualifying for Inspire as the next step?
Right. So I think if somebody is using CPAP and is using it successfully, then it's not going to be approved by insurance. And again, realize what I was saying before is that no treatment is perfect. Each one has advantages, disadvantages, likes, dislikes, and may fit well with different people. So if you have something that works, that's what I say for all my sleep apnea patients. If you got something that's working, stick with it. And unless there's something that that completely changes the way we think about sleep apnea. The rationale from the insurance companies is the cost of the device and implanting, not so much the implanting, but the cost of the device. And so if in the future, this device becomes pretty cheap, you never know. They might say, okay, you can use CPAP or have a neurostimulation, but right now it's really for failure. So failure means that, again, there's no absolute definition, but it means that, you're not getting a benefit from CPAP because you can't use it, for the duration of your sleep. It wakes you up, you really can't. You don't get a good night's sleep with it, and you're struggling to use it, or you've tried it for a good period of time and you quit because you just can't do it. There's no strict definitions, but that's what I would think of as a CPAP failure when it comes to candidacy for the Inspire system.
Great, thank you so much, Dr. Jacobowitz. This is the end of our Q&A question session.
Thank you so much. I thank you all for attending and taking time from your evening. And I hope this was informative. And of course, I look forward to seeing some of you, if you're able to, at my office on 18 East 48 in Manhattan. And you're also welcome, of course, to go online if you want to make an appointment at entnalgy.com/Jacobowitz or nysleepsurgeon.com. And I also want to really greatly thank Megan and Inspire Medical Systems for hosting this webinar.
Thank you so much. Appreciate it. Have a great night, everyone, and thank you for attending. Thank you, Dr. Jacobowitz.
Thank you.